Done. Welcome, everyone. We'll get started in a few minutes. Let a few more people jump in first. Okay, so we have a lot to cover today, so we're going to go ahead and get started. This will be recorded though, and if people join late, they can view the beginning later. But welcome everyone. We are so excited to officially kick off the California Harm Reduction Initiative RFP, and welcome to our webinar today. So first, a little housekeeping, just making sure everyone can hear me. If you can't, I hope that this instruction helps. You can go to your audio settings at the bottom left-hand corner and adjust from there. Click the drop downs to change the audio devices or adjust the sliders to change the volume. So what is your role today? It's a pretty easy one. We are recording this webinar to serve as a resource for any applicants. And you can refer back to this webinar at any point during the application process. We will also maintain a frequently asked questions section on the website that will be updated on an ongoing basis. And you'll also notice today that there's not a chat box, but you'll see a Q&A box. We are using that to collect any questions you might have during the webinar, and they'll be posted on the FAQs on the website. If you do have any kind of technical issues, though, feel free to ask those questions in the Q&A, and we'll try and help you out. Okay. And the goals of today's webinar, we're going to walk through the RFP under the CHRI initiative, review the overarching goal of CHRI and how this RFP fits into the bigger project, review the details of the RFP and the instructions step by step, go over individual questions of the narrative proposal to set expectations. We'll review the budget template and instructions with you. Also the additional documents that are required, and share the timeline and where applicants can read the frequently asked questions. And with that, I will hand it over to Savannah.
Thanks, Helen. So I'm so excited to be here, and many of you know us, but in case you don't or are less familiar with our work, I just wanted to introduce who Harm Reduction Coalition is. You can move to the next slide. So we, essentially this is just some photos, but we are a national capacity building and advocacy organization that spans the US with offices in New York and Oakland and increasingly staffed throughout the country, focused on initiatives that support statewide, federal, and local initiatives around people who use drugs. We host convenings, we do trainings and technical assistance, we create online content, we do advocacy and support legislation. And just last year, we launched HEP Connect, which was our first time being a funder and creating a whole grant making initiative to fund harm reduction programs throughout Appalachia. And we're really excited to bring the knowledge from that project into the CHRI initiative. So today we have a group of us here from Harm Reduction Coalition, obviously not everyone, but I wanted to introduce the folks who are going to be working on this project and this webinar with you today. So you can see me in the top left corner. For those of you who don't know me, I'm Savannah O'Neill. I'm the Capacity Building and Community Mobilization Manager in Oakland, California, supporting California-based work. And I'll pass it over to Laura.
Hi everyone, I'm Laura Guzman and I'm the Senior Director of Capacity Building and Community Mobilization and just joined the coalition in February. Very excited to be here.
Hey y'all, my name is Logan Benton. I am there in the top right corner. I am the Grants Manager for Harm Reduction Coalition and I'm based in Birmingham, Alabama.
Hey everyone, my name is Helen Jones. I'm teeing off the bottom left corner, and I am the Director of Operations, and I am based in our New York office.
Hey everybody, this is Jenna Haywood. I am the person holding the dog on the screen, and I am the Capacity Building and Community Mobilization Manager based in Oakland and supporting California initiatives. Hi everyone, my name is Tara Haywood. I'm on the bottom right there with the glasses, and I'm going to be doing administrative support for the CHRI grant making initiative.
Great, thank you all so much. And I also want to introduce you to someone that we're really excited to have on board at Harm Reduction Coalition as a consultant. And so we've mentioned this throughout the process of CHRI, but since we have such close and deep relationships with the California Syringe Exchange programs, we wanted to make sure there was someone available to offer conceptualization about your proposals, talk through your grant writing, and really help you along that process that wasn't people that were directly involved with the funding. So we hired Ryan White to do that direct support. Will not be writing proposals, but will be available to do TA and kind of coaching throughout the grant writing process. So Ryan, you want to introduce yourself?
Yeah, thank you so much. Hi, everybody. My name is Ryan, and that's my dog, Dottie. But I was a volunteer with a needle exchange program in Berkeley Needle Exchange Emergency Distribution from 2008 to 2015.
Lost you, Ryan.
Do you hear me?
Now we can. Keep going.
Okay, great. Sorry about that. Anyways, yeah, I was a volunteer with Berkeley Need from 2008 to 2015, but I've also have spent the last decade working in and around local government agencies doing strategic planning, evaluation. I've also done a lot of like proposal and grant writing, as well as supporting procurement processes. So I'm really excited to be able to integrate, you know, my passion for harm reduction and needle exchange programs with some more of my professional experience, you know, working with local government agencies. So I'm really happy to be with you all during this process. I feel like this is almost like a historic occasion, you know, remembering back to my days working with NEED and, you know, how little funding there was to support programs like this. So I'm really excited, really happy for everybody who's part of this process. Thank you.
Thanks so much, Ryan. So the email there that you see and we'll see throughout the presentation is CHRI@Harm Reduction to be connected, and we'll continue to kind of share the ways to be connected to Ryan and that support. So what is CHRI, right? You all have been hearing a lot about this. We've been talking about it for a long time, but what exactly is it? So how did we get here? Many of you know that story. For the last 2 years, there was advocacy that was led by probably most of the people on this call, the California Syringe Exchange Program, Drug Policy Alliance, and Harm Reduction Coalition to get funding that we were calling CHRI. It was funding to support staffing at syringe service programs and to strengthen the response to substance use disorder by really funding staff in those programs. And it was allocated in the Budget Act of 2019. So this is just a huge victory. We've celebrated this a lot, but remembering that this is how we got here and how we got to the RFP we're talking about today. And so really when we look at what the California Harm Reduction Initiative is it's 3 parts. We're really focused on grant making today, and that's been the biggest launch so far, and that we will act as a grant maker to increase paid staff at qualified syringe service programs. We're going to talk a lot about that today and get more into what that means. But I also want to touch on the fact that there are 2 other components to this project that I'll again touch on at the end of the webinar, but we're going to bolster the training and technical assistance that we provide in the state of California and work with the California Department of Public Health Office of AIDS to develop and deliver a series of trainings. And National Harm Reduction Coalition is also going to create a peer mentorship program that fosters relationship sharing between the sites and syringe service programs. So I'll talk more about that, but I'm really excited that we'll really get to strengthen what we've already been doing in the state. And then of course there's evaluation. We will evaluate the results of the program in collaboration with grantees. So that will look like some reporting. It will look by really being able to tell the story of your impact to make sure we understand how important this initiative is and moving forward are able to advocate to continue this funding. So next, so today we're talking about grant making. So we're going to act as a grant maker, and what does that mean? So if you go to the next slide, really we're talking about an RFP to begin with, right? And so how did we get to the place that we have an RFP for you all to look at? You might have looked at it already in the last couple of hours. We really have been listening to both what we asked the legislature to fund, so part of it is guided by that, and also ensuring we were talking to people. So we reviewed the stakeholder interviews that the California Department of Public Health did with 30-something syringe service programs. We reviewed priorities that came out of the California Syringe Exchange Program Conference in 2019. We looked at the listening session data from Harm Reduction Coalition's series of listening sessions across the state. We also just talked to people in a bunch of formats on webinars, on phone calls, and we reviewed what the data was across the state of California to really inform what was most crucial to fund, what people wanted us to fund, and what would make sense for the huge variety of programs that exist in the state. And so what is the overall goal of the RFP? So really we will be funding $12.6 million in grants over a 35-month period, which is essentially 3 years, to support staff, right? We keep saying that, to increase human resources capacities within your syringe service programs. And that's to do a couple things. The first is to expand the range, reach, and quality of harm reduction services. So not just expand and create a lot more programs or more access points, but also really deepen what that means. And that includes establishing and enhancing collaborations between programs and other care, medical care, social services, substance use disorder treatment, and just ensuring that we're able to actually be a part of a web that allows our participants to reach other services and to deepen the relationships we have with our participants. And we are seeking proposals that build upon local expertise, which you all have, and really that has a connection to other folks with local expertise, that we uplift the voices and priorities of people who use drugs, and that we center racial justice. So those are the kinds of proposals we're looking for that have threads of those things. And I'm going to pass it off to really talk about what we're asking for in the specifics of the RFP.
Okay, thank you, Savannah. You can go ahead and go to the next slide, Helen. Perfect. So as you all can see here, these are the important dates for this process. The deadline for questions to be addressed in the FAQ is June the 8th at 11:59 Pacific. The grant application deadline is June the 17th at 11:59 p.m. Pacific. We will announce the awards July 24th. And then the grant period is August 1st through June the 30th, which is a 35-month contract period. Okay, so again, what exactly will CHRI fund? And a lot of this goes back to the things that Savannah referenced. So we will be really focusing on increasing human resources and capacity at SSPs. We're really looking to deepen connections, expand the range, reach, and quality of services, establish and enhance collaborations with other community partner organizations, things like that. And we do recognize that this will look differently for all of your programs and all of your various areas, and we will take that into consideration. And we just ask that you do whatever makes the most sense for your program and your community to, again, deepen those relationships and increase human resources. Okay, so these are some examples of things that the CHRI funding could be used for. To get a little bit more specific, again, we're looking at deepening relationships, new resources participants may request, such as legal aid, mental health services, staff to develop strategy and implement plans to reach marginalized communities, employment opportunities to build up those who are your participants or other folks in your communities with lived experience, things like that. And again, these are just some examples. We do recognize that it'll be different for every program. We're very aware of that. So again, just do your best and do what makes sense for your program. Okay, the things that this funding cannot be used for. You cannot use CHRI funds for lobbying activities, for vehicles, screening kits, or illegal activities. So as I mentioned earlier, this is a 35-month contract. We are gonna do so it's 3-year funding. So technically a 3-year contract with annual renewals. And at those renewals, you'll be able to revamp your scope and your budget, because we recognize that what you write for now may not exactly be what your needs are in the next year or two. And so we do want to be flexible with that as long as it fits into the overall scope of the project, which again is increasing human resources and capacity within SSPs. Okay, so who can apply? To be eligible for this funding, you must either be a registered 501c3, a fiscal sponsee of a 501c3, or a local health department. Additionally, you must be authorized as an SSP by your local government or by CDPH, or be a physician-led program. With that, you also can have just started that certification program. So as long as that certification process, as long as that process has been started before you submit your CHRI proposal, then you will be eligible for this funding. Okay, if you are not an SSP or your organization does not have an SSP program underneath your umbrella, then we ask that you look into partnering with another community organization that is an SSP and consider subcontracting if that is an option that they will consider. We do highly encourage organizations partner for this work, as we're truly also going to prioritize linkage to other social service programs. Perfect, and I will pass it on to Laura.
Great. I am going to walk us next for the next 10 minutes or so on the purpose of the narrative proposal, specific instructions, and also we'll do every individual question. So what we want in this narrative proposal, the purpose is we want to get a sense of your project summary, the background, context, and needs of your communities, and what your organization is doing with what capacity. As has been mentioned before, we're also seeking, we want to know how are you seeking to expand or deepen your services and establish or enhance collaborations with critical partners. We also want you to reflect on how you do this work and see whether your practices should include more people who use drugs in your planning, implementation, evaluation, outreach to communities of color and other vulnerable populations you may not be reaching to, and who are you working with? And also, what does your organization and your community expect to learn after this 35 months of the CHRI project? You can go to the next one. As part of the RFA, we're including an optional tool that we call Planning Worksheet that we hope supports your organization in the planning and conceptualization of your project, and hope that it works for those of you who are very new to grant writing, as well as those of you who are seasoned. That tool can help you to pause, reflect, brainstorm about your proposed project, think about the opportunities to include communities most impacted in your region, and also challenging yourself to think about the impact of this funding. One caveat on the planning worksheet is that if you plan to work with Ryan and solicit his coaching support, we're gonna ask you to complete this worksheet before you contact him. We can move to instructions. So the instructions, we are asking you to write your responses up to a maximum of 8 pages total for questions 1 through 11. And we're gonna go through each of them. To be considered for funding, we want you to respond to all questions. And you'll see that question 12 is the only one that doesn't have to be included in the 8-page limit, and that's the budget question. The project summary is limited to 1 paragraph maximum, and other questions have suggested length for responses to provide guidance, but are not meant as required minimums or maximums. We can go to the next one. So on question 1, which is the project summary, we're asking you in 1 paragraph to summarize your project and include your key goals, activities, expected impact, and your amount requested. And if your project is funded, that will be the paragraph we'll use to announce the award. For question number 2, in background and context, we're asking you to describe your organization's current harm reduction work, including your accomplishments and challenges that you currently face. Also describe the communities you propose to work with, including your experience working with them and challenges they face. You can move to question number 3. In question number 3, we're asking you to describe your current capacity, including composition of paid, part-time, full-time staff and volunteers, finance and administrative roles and supports, and any existing structures that you have to manage your grants. We also want you to include how your staffing mirrors the populations with health disparities in your region community, including racial and ethnic demographics. We move to question number 4. On goals and activities, we want you to describe your proposed project and include at least 1 main goal. Describe the activities you will roll out to meet your goal or goals, and include a rough timeline, key people who will be responsible, and your desired outcomes. For question number 5, which we call deepening engagement, we would like you to describe how your proposed project will increase your organization's ability to help participants access medical care, social service partners, and substance abuse disorder treatments. We can move to question number 6. On harm reduction orientation, please describe how your project would advance the goals of harm reduction in your community, and how do you incorporate principles and best practices in the design of your project. Question number 7 is about the inclusion of people who use drugs. And please describe how people who use drugs are included in the development, implementation, and evaluation of your project. For question number 8, which we are defining as health equity and centering racial justice, please describe how your project will contribute to increasing health equity and address racial justice in your community, relevant to disparities based on economics or poverty, race, ethnicity, and other demographic data, such as other vulnerable populations, sex workers or migrant communities as examples, and or geography. For question number 9, we want you to describe the partnerships existing and or new that will be necessary for your project's success. For question number 10, monitoring, we would like you to describe how you will track and document progress on this project and measure its success. And question 11, learning, we would like you to describe what you hope your organization learns and how this learning could contribute to other harm reduction projects in the region. And the last question, number 12. And again, this one is one question that does not have to fit within the 8 pages limit. In the budget justification, please describe the main components in your budget and how they're related to your project activities. So I'm going to move into the formatting. We would like you to submit your narrative proposal as either a Word document or a PDF and include 1-inch margins, Arial 12-point font, single spacing, and listing the question number and header of each question. So number 1, project summary, number 12, budget justification, etc. And remember to name your file according to the instructions on the cover letter, which I think will go shortly on the description. I think. And I'm sure that the presentation, this part may have generated questions. Remember, the question box is open now under Q&A, and any questions you ask today will be part of the frequently asked questions document that we will maintain and be updated on an ongoing basis and posted on our website. If you review the FAQ and none of your questions are included, please email your question to CHRI@harmreduction.org, and we will be accepting your questions through June 8th only. So now I think I'm going to pass it to Logan to do an overview of the budget.
Perfect. Thank you so much. Okay, everyone. So we understand that budgets stress people out. That's just the reality of it. So we've kept that in mind, and we're trying to keep things as simple as possible throughout all of this. So really what this process will be, it's truly y'all just thinking about what you need to do the work and writing it down. I really want to reiterate that your budget template will not be scored. So with that, we really just want you to do your best. We're truly looking to see that it makes sense and reflects the work that you described in your proposal. But again, it will not be scored. So with that, where you can find all of this information, the budget template is an Excel spreadsheet that we have included on the microsite. You can download that directly. And with that, we request that you do fill it out in Excel, because you'll be able to see the comments and formulas that we have put in. So it's likely easier for y'all to just keep that in Excel. The other piece of this is the budget justification question, which Laura just referred to, which is question 12. And it also will not be scored. Again, we really are just looking to see that it made sense and connects the main components of your budget to your proposed activities. So in this justification, you'll tell us about your staffing, how you got to the number you listed for office supplies, etc. Okay, so this is tab 1 of the budget template. So tab 1 is budget and instructions. Tab 2 is the actual template, and tab 3 is the indirect policy explanation, which we'll get kind of to all of that later in this segment. Please read the instructions carefully before working on the budget And keep in mind that the formulas are already set to make it easier for you, and there's lots of helpful comments actually in the budget template itself. Again, it will likely be easier if you fill this out in Excel so that you can see the comments and the formulas. So I know this is just a screenshot, but there's more instructions when you actually download the template itself. Okay, so this is a screen grab from the second tab, which is the budget template. As you can see here, we've broken it up into 3 periods. Those 3 periods are for each year of the 3-year grant. And if you'll notice, period 1 is only 11 months. We have a comment in the spreadsheet that will help you do those calculations for your period 1 FTE. So quickly, just so everyone is on the same page, your FTE is a full-time equivalency, which is the percentage of time that someone spends on the project. So like I said, we do have a comment that kind of explains that a little bit more in depth actually in the template. And so you'll be able to see that for a full-time staff that may work all 11 months of this period 1, you would do 1, which is the equivalency of the full-time, divided by 12 times 11, which would then calculate itself over to be 92%. Again, I know that seems like a lot, but we do already have the formulas populated, and there is the comment there that is kind of just a reminder of how to break that up. And you will only be filling out the blue cells in this budget template. The gray cells will auto-populate based on the information that you provide within the blue cells. So fringe are benefits paid on top of a person's salary, such as health benefits, disability benefits, 403B. It's usually expressed as a percentage of the person's salary. So with that, you would just enter in what your fringe is, and again, it would auto-calculate over in the gray area. If you notice at the top, there is a cell for inflation per period if applicable. So this is where if your organization plans to give everyone on staff, say, a 3% raise every year, you would just write the number 3 in that blue cell, and it will again auto-calculate based on the salary and the FTE percentage that you have provided in cells below, and that inflation will be adjusted in the gray cells. So again, you would just enter in the number 3 right there. It will automatically pull over in the gray cells for you. Please do not directly enter things into the gray cells. Okay, so the next section of the budget template is travel, other direct expenses, and then consultants, subcontractors. So consultants are anyone doing the work that's not paid staff. Travel is going to be any relevant travel or mileage for events once they are able to happen again, or possibly for outreach, things of that nature. And then other direct expenses are basically anything that doesn't fit into the other sections. So that's going to be if you need to buy computers or other technology or other general expenses that you need to make this program happen. Okay, so the third tab is the indirect rate explanation. So with this funding, you have the ability to use up to 20% for indirect costs. So anywhere up to 20%. Do not stress about this too much. If you miscategorize, we can figure that out moving forward. So it won't, at this point, will not truly directly impact whether or not you receive funding. But just try to keep this in mind when you are filling out the budget template of these explanations of indirect costs. So truly just try your best and we will figure it out. Again, this budget template will not be scored. It's just to help us get a better understanding of the correlation between the funds you expect to need and your project activities. Again, as a reminder of what I stated earlier, as you're navigating through the budget template, funds cannot be used for lobbying activities. They cannot be used for vehicles, screening kits, or for illegal activities. And I will pass
Cool.
this on to Helen.
So like we just saw, this is the application. It is a Google document, and you can, it's a Google form where you'll upload all of your pieces of your application. You'll need to make sure to complete all the required sections. They're marked with a red asterisk. And then you'll see some organization questions, including your org budget, contact information, and how much you're requesting. Please double check that your contact information is correct. I can't emphasize this enough. This is how we will reach out to you with questions on your application, and as to let you know about the actual funding. This included here is a proposal checklist. It is also on the CHRI website, and here you'll see all of the things that you need to have and any kind of naming conventions we ask you to use. We'll accept PDF, Word, and Excel files only. And if for some reason your organization does not allow you to upload documents to Google Docs, we understand. Please reach out to us at CHRI@harmreduction.org, and we will help you submit. Okay, so required attachments. First, you'll see the CHRI proposal narrative, and you'll be able to upload your file directly there. Please follow the naming convention of your organization name - CHRI proposal narrative. Same with the budget, you can upload that there. And then you'll see the 501c3 determination letter request. Here, if you are a 501c3, please upload your determination letter. If you have a fiscal sponsor, please upload the 501c3 determination of your fiscal sponsor. And if you are a local health department, we understand that you won't have either of these things. So please just upload a memo regarding this and letting us know your status as that local health department. Finally, as Logan mentioned, we'll need to also include your syringe services program authorization document. So some of you might already have this, and if you do, please upload it here. If you have applied for this authorization, please also upload that here. Remember that you have to have applied for authorization before you can submit your proposal. Other documents that you'll have to upload. First is your most recent audited financial statement or your 990 filing. Any kind of MOUs. So if you're proposing a collaborative project with one or more organizations, please fill out an MOU and upload it here. And then finally, this final piece is totally optional, but letters of support. You can submit up to 3 letters of support on behalf of your organization. And then finally, you'll just hit submit, and all responses will be emailed to you as a confirmation that your application has been received. Okay, so what do we not need? Any other document that is not on this list. That's pretty easy. Please note that if you do submit other documents, they were not going to be considered as a part of the application review process. You can include hyperlinks in your narrative proposal if it's relevant, but we cannot guarantee that the selection committees will review the links that you provide. Okay, so let's talk a little bit more about the timeline. So CHRI request for proposals released today. How exciting. And we have until June 8th to submit any questions that you might have to CHRI@harmreduction.org or in the chat box here. And we'll answer those questions as frequently as possible. We'll respond via email and update the frequently asked questions document on the website. On June 17th at 11:59 p.m. Pacific time, your applications are due to Harm Reduction Coalition. So you need to have hit that submit button by 11:59 p.m. Pacific. HRC will then go start the review process, including an external review committee in July. CDPH will see all of the grantees that we're suggesting. and we'll make the final selection and announce awards on July 24th. We'll then go into contracting, and the start of the grant period will start August 1st and will end in June of 2023. So here's an easier view. The request for proposals opens today, May 20th. You have about 5 weeks to complete your application. It is due on June 17th. Please remember that FAQs we're going to stop those on June 8th. So please start this proposal process sooner rather than later. We want to make sure to be able to answer all of the questions you might have. And then finally, about a month later, we will announce awards on July 24th. So what if you're not selected for funding? We do expect this to be a very competitive process, and we want to commit to as many programs as possible, but we also want to ensure the awards are meaningful. No matter what, you will hear from HRC if you did or if you were or were not selected as a grantee for this process, and that will be over email. And then something else to note is that even if you're not selected, all syringe services programs in California will have access to CHRI funded training and technical assistance regardless of award decisions. Savannah's going to talk a little bit more about peer mentorship as well. Unfortunately, that is only open to our grantees, but training and technical assistance is open to everyone. Okay, and with that, I'm going to pass it off to Savannah.
Great, thanks so much, Helen. I'm so sorry for that disruption. It really threw me off. So I appreciate you all bearing with us. And we've been gathering the questions that are coming through the Q&A box and collecting them to be answered in the frequently asked questions document. We've gathered most of them, but if you asked a question that has not been answered, if you want to just go ahead and post it in the Q&A box, we'll make sure those get recorded, because when the recording cut out, we didn't capture every single question. So please feel free to re-ask your questions there, and that would be really great. So now we're moving into training and technical assistance. So like I said, there's other huge, big components of the CHRI project. It is not exclusively grant making. And the first is training and technical assistance. So if you go to the next slide, we'll talk a little bit more about what we're offering through the training and technical assistance. So, you know, many of you already received this kind of support from Jenna and I, from other folks at Harm Reduction Coalition, and from the California Department of Public Health. But we're going to build out more opportunities offered by those entities, as well as hiring consultants with expertise on specific topics. And this will be available informally in one-on-one sessions and meetings, the way we have been doing it, as well as formally through small monthly groups and other structures to really facilitate learning. Also in 2021, we're launching a virtual learning collaborative that will be co-hosted by the California Department of Public Health Office of AIDS that will offer monthly workshops. So I want to highlight this one both because I'm really excited about this as an opportunity, but also because CHRI grantees will be required to participate in at least 50% of the sessions that we do as part of the learning collaborative, as well as participate in small group-based meetings between sessions to discuss what you learned, how you're thinking about implementing those ideas, concepts, or interventions into your program. So we're really hoping that's going to be a space people want to be involved in, and what we do with those workshops will be guided by you all and your needs, and it can involve really technical things as well as, you know, ways that you want to move your work philosophically or structurally. So we're really still developing that, and I'm really excited to launch a learning collaborative and learn and share skills together. So that's kind of a broad overview of the training and technical assistance. And I just wanted to make sure you all knew that that was coming and is part of this project. So another part is, what's this peer mentorship thing? We've mentioned it. I'm really excited about this, and really what this is facilitating programs' abilities to shadow other programs. So in a process that's separate from this RFP, once CHRI grantees are awarded, you will have an opportunity to submit interest in being a host site. So essentially you would get to apply for additional funding to act as a host site for other grantees. And in that role, you would receive coaching from us. you would submit a plan of what does a 3 to 5 day visit in your program look like? How would you support that person? What kind of shadowing opportunities would they have? And you would be able to provide support for grantees looking to build out specific areas of their work. And there's more details about that, but if someone is looking to build out a specific thing that one other program does really well, then being actually able to be there and witness it happen. And programs that are interested in visiting sites will have the opportunity to apply for money to fund that travel for in-person learning. And I'm really excited about this because we realize that, you know, me, for example, I'm in a really privileged position to get to be able to see all these programs across the state of California, be able to visit programs nationally. And a lot of folks that I talk to have never been to another syringe service program, don't know what a different program looks like. And I feel like it can really foster a lot of great ideas with all the brilliant things you are doing. So this will be a core part of the project after we do the initial grant making. And for the last piece, evaluation. So I've seen some questions come in about this, and I know this is a really important thing for you all to understand. So we will evaluate the results of the program in collaboration with grantees. So what does that mean? So we will develop a low threshold short and high quality reporting tool that you all will report on your impact. It won't just be quantitative checking boxes for how many people you've gotten into treatment, but really seeking responses that get it. How connected are you to other programs? How successful are you in navigating people to care? What does access look like in your community, and how have you mitigated the lack of access potentially? How are you centering equity and racial justice, and what's your outreach to hard to reach populations look like? And these will be questions that can be asked regardless of your proposal, really seeking to show the impact of funding syringe service programs on the ground. So there will also be surveying of participants, and these fiscal and programmatic reporting will occur every quarter. So we don't have the tool here to show you yet, but we will have it before contracting. So all the tools and details you will need to know whether you can commit to doing that or not will happen at contracting. And we're really trying to make this an evaluation that is meaningful, but also takes into account the program with the least amount of experience, capacity, and infrastructure to still be able to engage in these things and really tell the story about what your program is doing. So we will create all those tools. They'll have input from the same sources we've been getting input for to create the RFP. And we will have those released before you sign your contracts. And again, if you still have questions, we'll maintain the frequently asked questions document on the website that will be updated on an ongoing basis. We'll start doing that this week. I wanted to go back to one specific question that I've seen come up a few times and was highlighted in the beginning of the presentation, just to say it out loud on this webinar, that we do have a range for awards, and you can see that on the webpage, but what it comes up to annually is around $25,000 a year to $150,000 a year, which is what programs can write for in their proposals. So just knowing when you walk out of this webinar, that's the range that we're looking at to fund, clearly understanding that programs are gonna need a lot of different things. And any other questions related to the awards or anything else will be answered in the frequently asked questions document. If you go to the next slide, we're really excited to just celebrate you all writing these proposals, excited to see what you come up with. And there's more in-depth information on some of the pieces we touched on this webinar, hosted on our webpage that went live today at noon. It includes all the documents that we referenced with the narrative proposal, with the budget template, the cover sheet that includes all the items that you need, as well as a description of the award amounts and deadlines and timeline. So that is all hosted on our webpage. We will make sure we send it out with the recording, and the recording will be hosted on the webpage by Friday of this webinar. So thank you so much for participating, and good luck with your project proposals.
Hey, whoops.